wearing of face masks on London's buses and tube network will be enforced beyond Monday. The capital's Mayor Sadiq Khan says it'll protect staff and give customers confidence to travel. The government insists that's very much in line with what it expected and that individual companies can bring in their own conditions. In Scotland, Nicola Sturgeon's announced face coverings will still be mandatory as restrictions are eased there from next week. Wales's First Minister is going to be announcing later changes to the country's COVID rules, although he's already said masks will still be compulsory in certain settings. Well, joining me now, Dr. Bharat Pankhani, a clinical epidemiologist and senior lecturer at the University of Exeter's Medical School. Good morning to you.
Hello, good morning.
Always good to have you with us. Thank you. Well, shall we look at the issue of masks then, firstly? Are leaders, do you think, like London's Mayor, Scotland's First Minister, right to be taking such a firm stance when Westminster says, ultimately, it's up to the public now, it's our choice, certainly in England?
Well, I'm so pleased that there are people like the Mayor of London and the First Minister for Scotland who can take these decisions, because ideally, I personally feel the decision should have come from Prime Minister Johnson, because if the decision comes from Prime Minister Johnson, it makes life that much easier. It is a lot easier if the government says wearing of masks is a good infection prevention measure. We should do it in crowded places.
Do we face real dangers to full reopening while infection levels are still rising?
Yes, we do, Lisa. And, it is sort of the writing is on the wall. We have a background of a highly infectious variant. We have case numbers going up. And at the same time, not only are we opening up, which was expected, but we are also dropping our infection control measures. So here on in, apart from people like Mayor Sadiq Khan and First Minister Nicola Sturgeon being able to do what they can do locally and in a limited way, I get the feeling infection control measures are being dropped and left to individuals to implement. Individuals will not implement them.
What would be your advice then to, say, people heading back to work, going to sporting events, going to nightclubs?
Nightclubs is a big one. I worry about it because I don't think there is good governance in place for nightclubs. So for me, a nightclub is a big no at this point in time, because it will be young people, most probably not immunized as yet, and it is a crowded place, loud music, so you'll be talking at full volume to others. So no. So with respect to going to work, I would say don't drop your guard, and wear a mask on public transport, but more so wear a better quality mask. I advise wear a FFP2 mask. It's more tighter fitting and gives you a better level of protection compared to the loosely fitting surgical masks that we have been wearing thus far.
Good advice indeed. Dr. Pankhani, about half an hour ago, we were speaking to our correspondent over in Paris. I wouldn't mind getting your viewpoint of what's happening over there, for example. 20,000 French people a minute, we're hearing now, booking vaccine appointments after an announcement from the French president when he said that cafes, restaurants, shopping malls and trains are going to be out of bounds entirely for unvaccinated customers from next month. Pretty hardline stance there. What have you made of that?
Was pretty hard line. I wasn't aware of this, but that's pretty hard line. I because I've been doing immunizations for most of my career, 30 years plus. And I think the best way to immunize people is to inform, advise, educate, and show them the benefits of the vaccine compared to the risks of infection. So my line would have been a big blitz of information, advice, and that sort of way to persuade people to take up the vaccine and save their lives, protect them from ill health.
Back home here, just finally, when it comes to other headlines, for example, this morning, anger over chaotic plan for return to UK offices, business chiefs calling for more clarity from the government for Freedom Day and warning of gaping holes in COVID COVID guidance. Front of the Telegraph, UK travellers with Indian AZ vaccine barred from actually going on holiday. They've been stopped trying to get out of the country. Yesterday, of course, we saw the BMA calling the government's mixed messaging irresponsible. It's not exactly looking particularly smooth for the 19th, is it?
No, it isn't. And I always wonder how the big machinery of government can get certain things so wrong. The one thing that I feel they've got very, very wrong is the immediate dropping of all infection control measures like masks in public places. And then we need the mayor and first ministers and others to intervene. It really is an easy thing to have said and done is we will keep masks as a compulsory thing in crowded places.
Dr. Pankani, always good to get your views. Thank you for joining us. Clinical epidemiologist there and senior lecturer at the University of Exeter's Medical School. Also in our headlines this morning, the